Deep lateral rotators of the hip. So there are 6 small, deep, and mostly posterior muscles that span the hip joint in a horizontal direction, and we call these our deep lateral rotators of the hip. So I'm going to name these off real quick. That would be very important to know, is just the names of these muscles. So we have the piriformis, the obturator externus, the obturator internus, gemellus superior, gemellus inferior, and then the quadratus femoris. So these are the 6 muscles that work all together to help laterally rotate the hip. And again, it's in the word, right? So these are very deep muscles. So they're underneath all the other superficial muscles that we have. Now, looking at origin and insertion for these, I really just want kind of a generalized version. So we're going to say the origin, looking at these in a general sense, is the anterior sacrum, ischium, and pubis. Their insertion point is going to be in the greater trochanter area. Their action, so it's in the name, they do hip lateral rotation. And then nerve, for our class specifically, I'm not going to require you to know the nerve for each of these, but it is in your textbook. So your textbook will have a table that will show the nerve for each one of these. One last note I will say, the piriformis is a very interesting muscle here. It can create a lot of problems and pathologies that we'll definitely look at in the future. But just a note, so adaptive shortening of the piriformis, it can actually compress the sciatic nerve, and with that compression, that can cause pain and radiate different nerve-like symptoms, burning, tingling, numbness down the back of the leg. So that's definitely something that we want to keep in mind as we go forward. We don't want to overlook these muscles even though we group them together, especially the piriformis, because we'll see with pathologies later that it becomes very important.